The brain, which I have pictured here to the left, is the control center of the body. This means that the brain stores your memories, regulates organ function, and even controls your thoughts, actions, and emotions. This also means that when your brain is doing well and is healthy, which I've shown here by a thumbs up sign, you can expect your brain to work very quickly. Now, if your brain is not healthy or has problems, you can expect very drastic and deadly results. Now, various problems in the brain can damage your ability to think clearly and can also damage your overall brain function. brain diseases vary from many things. For example, some brain diseases are genetic, and we do not know what causes some brain diseases. Also, different brain diseases affect different areas of the brain. So, since different brain diseases affect different areas of the brain, you can expect different symptoms and different life expectancy. An example of this is that strokes, which is a type of brain disease, are the number 2 killer in the United States, which means that it is the second most cause of death in the United States, and heart failure is the first. While other brain diseases barely make the top 100. Another example of this is that since different brain diseases happen in different areas of the brain, you will expect different symptoms. For example, the section of the brain that controls memory loss, controls the part that stores your memories, will if you get dementia, you will have memory loss. But the part of your brain that controls motor abilities, when your motor abilities start to worsen, that means that you have Parkinson's. So the different location in the brain will affect your symptoms and your life expectancy. For example, dementia and Parkinson's have very broad life expectancy. Major brain diseases are categorized into 7 different categories: infections, seizures, trauma, tumors, masses, and increased pressure, vascular conditions, autoimmune conditions, and neurodegenerative conditions. The infections category includes meningitis, which is an inflammation of the lining around the brain or spinal cord, usually caused by an infection, and encephalitis, which is an inflammation of the brain tissue, usually due to a viral infection, and meningitis and encephalitis usually occur together. Brain abscess, which is a pocket of infection in the brain, which is caused by bacteria. Next, we have seizures. In seizures, we have epilepsy, which is a condition characterized by reoccurring seizures caused by abnormal and excessive electrical activity in the brain. Then we have trauma, concussion. A concussion is a brain injury that causes temporary disturbance in brain function. Traumatic brain injury is acquired and is often a permanent brain damage from a traumatic head injury. So the difference in between these two is that this one is permanent and this one is only temporary. Then we have intracerebral hemorrhage. Any bleeding inside the brain, which may occur after a traumatic brain injury or stroke as a result of high blood pressure. Now we have brain tumors, masses, and increased pressure. First, we have a brain tumor. Any abnormal tissue growth inside the brain, whether cancerous or non-cancerous. Now we have glioblastoma, which is an aggressive cancerous brain tumor, and it progresses very quickly and is very deadly. Then we have scleroderma tumor cerebri, which is a false brain tumor. Given by the name, it's just increased pressure in the skull with no apparent cause. Then we have hydrocephalus, which is an abnormally increased amount of brain fluid inside the skull, and this is caused by fluid not circulating properly. Then we have normal pressure hydrocephalus, where it's basically like hydrocephalus because it's a form of it, but the pressure inside the brain stays normal, even though there is extra brain fluid. Now we move to vascular conditions, which are caused by blood vessel failure. And so first up is a stroke, which is kind of the most basic form, where blood flow and oxygen are suddenly interrupted to an area of brain tissue, which may then die, and then the body part that is controlled by that brain tissue, usually you can no longer use because you can't control. And sometimes in a stroke, half of your brain may die. So, like I said earlier, it is a myth that you only use one side of your brain, but most of the things on that side of the brain will go false. For example, let's say you get a stroke on the right side of your brain. The right side controls the left. So your left arm would be hard to move, your left jaw would be hard. But then again, it can happen in all areas of the brain. Then we have ischemic stroke, which is a blood clot when a blood clot suddenly develops in an artery or is formed somewhere else and breaks off and lodges in the brain blood vessels, which is blocking blood flow and then again causes stroke. And a hemorrhagic stroke, when bleeding in the brain creates congestion and pressure on brain tissue, which impairs the healthy flow of blood to the brain, causing a stroke. Then we have cerebrovascular accident, which is known as CVA, which is just another name for stroke. And transient ischemic attack, which is known as TIA, is a temporary interruption of blood flow and oxygen to the brain. So it's kind of like having a stroke, but only for like a day because it leaves after 24 hours at most. And brain aneurysm, which is when an artery in the brain develops a weak area that swells like a balloon. And then a rupture to a brain aneurysm causes a stroke due to the bleeding. And then we have subdural hematoma, which is bleeding on the surface of the brain. Epidural hematoma, which is bleeding between the skull and the tough lining of the brain. So it's not necessarily bleeding in the brain, but like in between the brain and the skull in that area. Then we have intracerebral hemorrhage, which is any bleeding inside the brain at all. And then cerebral edema, which is a swelling of the brain tissue, which can be for like different causes, caused by maybe injury or electrolyte imbalance. And then we have autoimmune conditions, which is vasculitis, which is an inflammation of the blood vessels of the brain. So basically your blood vessels will just grow and grow and grow. And this causes confusion, seizures, headaches, and unconsciousness sometimes. Then we have multiple sclerosis, which is when the immune system mistakenly attacks and damages the body's own nerves. So it's basically a fault of the immune system. For example, when you're sick, your immune system lowers, but it helps to fight away that sickness. And if you were to get sick with multiple sclerosis, it would just become worse and you could possibly die because your immune system will attack your body even more. And then finally we have neurodegenerative conditions. First up we have Parkinson's disease, when it's just nerves in the central area of the brain degenerate slowly, which causes problems in movement and coordination. That's why it falls underneath the motor system category if you deeper categorize neurodegenerative conditions in motor system disorders because of the motor system problems that it causes. Then we have Huntington's disease, which is an inherited nerve disorder that causes a degeneration of brain cells. And most neurodegenerative conditions, basically, they get worse over time and they're chronic and progressive. So then we have Pick's disease, which is also known as frontotemporal dementia. And over the years, large areas of nerves at the front and sides of the brain are destroyed due to a buildup of abnormal protein. And neurodegenerative conditions in general will cause, even though they're all in one category, different things, but many of them cause inappropriate behavior and challenges with the muscles. So then we have Alzheimer's disease, which is for unclear reasons when nerves in certain brain areas degenerate, causing progressive loss of memory and mental function. And the buildup of abnormal tissue in the brain areas, often called tangles or plaques, is believed to sometimes contribute or cause Alzheimer's. Then we have dementia, which is a decline in cognitive function due to death or malfunction of nerve cells in the brain. And this is like another condition of when nerve cells in the brain degenerate. And this can be caused either by alcohol abuse or strokes. And then finally we have a kind of well-known one because of the Ice Bucket Challenge recently to help raise awareness for us. We have amyotrophic lateral sclerosis, which is ALS. And it's also called Lou Gehrig's disease. But in ALS, nerves controlling muscle function are steadily and rapidly destroyed. And it eventually progresses quickly to paralysis, and some people will often need help breathing because their lungs start to close, so they need like mechanical assistance breathing. So that's it for our background information for brain diseases. Stay tuned for Parkinson's Part 1, which is our next video. And bye!